ఈవెన్ ఈ రోజుల్లో ప్రతి ఒక్కళ్ళకి మీరు చెప్పినట్లు ఇంట్లో ఒకరికైనా అది యూస్ చేయడం తెలిసే ఉంటుంది.
One person in a home, if they know it, they can educate the rest of the family. That is the key. That's how people have to learn it.
Yes, true. ఇంకొక చిన్న డౌటు, ఇది నా డౌటు. యాక్చువల్గా ఇప్పుడు ఆన్లైన్ కన్సల్టేషన్ ఓకే, అన్ని విధాల నిజంగా చూసుకుంటే రేపు ఫ్యూచర్ అంతా దీంతే. చాలా మెరిట్స్ కూడా ఉన్నాయి, దానివల్ల టైం కన్జ్యూమ్ అవ్వదు, టైం సేవ్ అవుతుంది, ఈజీలీ అప్రోచబుల్, ఇవన్నీ ఓకే. బట్ సపోజ్ ద పేషెంట్ నీడ్స్ ద టెస్ట్ సపోజ్ క్లినికల్ టెస్ట్, హౌ దే కెన్ గో, అంటే ఇప్పుడు వాళ్ళు ఆ టెస్ట్లకి మళ్ళీ వాళ్ళు ఎలా వెళ్ళాలి, వేరే ప్రైవేట్ క్లినికల్ వాటికి వెళ్ళాలా, ల్యాబొరేటరీస్కి వెళ్ళాలా, లేకపోతే ఏదైనా పెద్ద పెద్ద హాస్పిటల్స్కి ఇప్పుడు సపోజ్ పేషెంట్ హాస్పిటల్కి వచ్చారంటే అన్నీ కూడా మీరు అక్కడే ప్రొవైడ్ చేస్తారు, దే కాంట్ గో అవుట్ సైడ్. ఇప్పుడు అన్ని వాళ్ళు అందులోనే ఫుల్ఫిల్ చేసుకుంటారు. అలా కాకుండా ఇప్పుడు ఆన్లైన్ కన్సల్టెన్సీ అంటే ఆటోమేటికల్లీ సమ్ పీపుల్ దే నీడ్ టెస్ట్ కదా, అప్పుడు మీరు ఎలా వాళ్ళకి సజెస్ట్ చేస్తారు?
So what we are doing in the online portals ante, we as doctors we are consulting the patient, seeing the patient by video calling, and some patients we talk on audio call. Once we do a video call, we see the patient, then subsequently we do an audio call. So we do prescribe him tests, we'll give them prescriptions and we do write tests. So వాళ్ళు ఏం చేస్తారంటే దే గో టు దేర్ నియర్బై laboratories or nearby diagnostic centers and get themselves tested. So there are many private diagnostic centers, the government is testing people with symptoms, so we advise them. So what the doctor does on online consultation is like how the doctor does on an OPD consultation. Basically we see the patient, assess his symptoms and write down what tests he requires. Here we just send them what tests he requires, or we write it on a prescription and sign it, and it is sent to him with our code and register number and all. So the patient can go to the nearby diagnostic center or the GH or the government health center and get himself tested. So that is how he'll test himself and then get back to us with the reports. So once we see the report, we'll assess the severity of the disease and advise him home quarantine or institutional quarantine. If it is home quarantine, we'll prescribe him all the medications. Again, he'll make an online order of the medications. He'll sit at home and get those medications and take care of his diet. We'll consult a dietitian online and follow his dietary practices and breathing exercises and all. So if we assess the severity of the disease and find it that he requires institutional quarantine, we'll advise him hospitalization. We'll suggest him a hospital, or he himself can come and get admitted into any hospital of his choice. So that the basic idea is the same as what we do in an OPD when we see patient face to face. So based on his diagnostic reports and the laboratory reports and seeing the patient virtually, we decide whether the patient needs hospitalization or home care. So based on that he goes. So yeah, having said all of this, nothing equals to touching the patient and seeing him, but in this era of pandemic, in this times of pandemic, this is probably the best solution that we have to reduce the patient load.
It's really good, doctor, you explained very nicely, really good. But ఇంకొక చిన్న డౌట్ డాక్టర్, ఏంటంటే ఇప్పుడు ఈ పాండమిక్ సిచ్యువేషను, ఈ కరోనా సిచ్యువేషన్ని ఓకే ఇప్పుడు ప్రజెంట్ మనం దీన్ని డీల్ చేస్తున్నాం, ఇది పక్కన పెడితే రేపు నార్మల్ మెడిసిన్ అన్నదే ఉంది, రేపు ఇన్ ఫ్యూచర్ కూడా ఆన్లైన్ మెడిసిన్ ఎక్కువ అవబోతుంది. ఇప్పుడు మనకి ఇది ఒక ప్రాక్టీస్ కింద అనుకోండి, మొత్తానికి మనం స్టెప్ ఇన్ టు ఆన్లైన్, సో ఆన్లైన్ మెడిసిన్. సో రేపు పొద్దున్న ఇదే మనం నార్మల్ డిసీజెస్కి, నార్మల్ హాస్పిటలైజేషన్కి కూడా మనం అప్లై చేయవచ్చు. అలా చేసినప్పుడు ఆన్లైన్ ఇప్పుడు సపోజ్ అబ్రాడ్ లాగా మనకి కూడా ఇండియాలో ఆన్లైన్ మెడిసిన్ అనేది ఎక్కువైపోతే, ఇప్పుడు సోకాల్డ్ ఎస్టాబ్లిష్డ్ పెద్ద పెద్ద హాస్పిటల్స్, 5 స్టార్ హాస్పిటల్స్, ఇవన్నీ కూడా కార్పొరేట్ హాస్పిటల్స్, ఇవన్నీ కూడా కొంచెం లోడ్ తగ్గి కొద్దిగా అంత ఆ ఫామ్లో ఉండడం, ఇప్పుడు ఉన్నట్టుగా ఇంత మనీ మింటింగ్ ఆఫ్ మనీ టైప్లో ఇప్పుడు పెద్ద పెద్ద కార్పొరేట్ హాస్పిటల్స్ ఉన్నాయి. సో ఈ టైప్ ఆఫ్ హాస్పిటల్స్ రేపొద్దున తగ్గే ఛాన్సెస్ ఉంటాయా ఆన్లైన్ మెడిసిన్లో అన్నది చిన్న డౌట్.
See, we can definitely extrapolate our online whatever we have, whatever information we have on online consultation, or whatever experience we have in online consultation into the non-COVID times as well. Okay, we can definitely extrapolate it, we can definitely drag it into that. Actually, some in the West it is quite a common thing to have online consultation, because patient doesn't there we they have long waiting periods, they have appointments for everything. Patients get scheduled with a primary physician first, then a family physician first, then a consultant. Not like here where people can come to whichever consultant they want.
ఈవెన్ డెంటల్ కూడా వాళ్ళు చాలా అపాయింట్మెంట్
things
తీసుకోవాలి.
are quite different in the West. So that is how they started online consultations. So here things are more liberal. People can walk into us, they can come to us whenever they want. They can just come to the OPD, get a receipt and come inside. So it's quite easy here. But at the same time, we can definitely do it into the non-COVID times to other healthcare problems as well, to medical problems and surgical problems as well. Yeah, definitely we can definitely extrapolate this and drag this online consultation experience into the non-COVID times as well. It is not that we have to strictly restrict it to the COVID times, but the thing in the West is that people go through, it is quite a difficult thing to approach a doctor there. They have a schedule for that, they have a process for that. They come to the primary physician, the family physician, and then finally go to the consultant if the family physician refers him, that too with all the diagnostic reports and all. Here on the contrary, here things are quite easy. Like, we are more liberal. Patients just walk in, take a receipt and walk into our consultation rooms. It can be any speciality. He can just say it to him, he can just himself come and ask for a neurophysician to a surgeon. It's quite a difficult thing in the West, whereas quite easy in the in our country. So that is the reason probably we are not encouraging online consultations, because when patient can walk in any time, why does he need online consultation?
Yes,
when there is no risk of a disease transmission, when there is no infection going around, it's quite easy for him to, it's quite feasible for him and for the doctor. When the patient walks in, he can see him and we will clarify our doubts and he clarifies his doubts. That is how things are going on here. But what we can definitely do is that we can reduce the patient visits. So you see the patient online and you schedule him to an OPD appointment, then you see the patient on OPD basis, give him some tests, then he doesn't have to come each time to show you the tests, doesn't have to come each time to tell you about his condition, about how he feels and all that. Even after probably you schedule him for a surgery, when the surgery is done and you send him back home, we can do an online consultation to see how he's doing. He doesn't have to make frequent hospital visits after his discharge. So that way, online consultation in the non-COVID era, like after the COVID time, can probably help us in reducing the hospital visits. Patient doesn't have to come so often.
Even hospitals also, they don't have this much glory and all. Maybe it will.
Yeah, I mean, hospitals probably will lose some patients if we do more of online consultation, but it is a good thing for the hospitals also. They can reduce all the crowd and the risk of several disease transmissions, the risk of patients keeping on coming and flooding the OPDs. So all this can be reduced to some extent, but at the same time, whenever a doctor consults online, he consults on behalf of his hospital. So the hospitals probably will not lose that much of their business.
Okay.
They'll still have their business, at the same time make things more peaceful and easygoing through online. Yeah, we can definitely extend it into the non-COVID times, but for now, I think in the COVID era, online consultation is here for a specific reason, and we can definitely do a lot through this. We only want to encourage more and more patients to come forward. When they're having mild and moderate symptoms, don't panic and rush to the hospital and infect a lot of people in your way to the cab, in the cab, or on your way to the hospital. You can stop doing that and instead consult us online.
It's very nice, doctor. You explained very nicely. లాస్ట్గా మా ప్రేక్షకులకి మీరు టేక్ హోమ్ మెసేజ్ ఏదైనా ఇస్తారా?
Sure. The thing is, COVID is here for a long time. It's going to be here for a few more days to come. So it's not that we are done with it. It's not that it's going to be over now. We do not have a specific date about it, but at the same time, this is not something to be panicked about. This is not something to be worried about all day. So what we can do is, through this specific portal or this channel, I only want to advise all these patients who are recently diagnosed with the COVID pandemic, with the COVID-19 disease, to consult your doctors online. We have a lot of online portals. We are endorsing one. We work for VHS services. So you can definitely contact us. talk to us online, assess your severity of the disease, get your assurance. And if you are not assured, or if the doctor says that you are not, you're not good for home care, you can always get into institutional quarantine. But first, don't panic and just go for an at least an online. Even if you're suspicious about something, you can always go for an online consultation. It is not necessary that you are diagnosed with COVID-19. Even if you're suspicious of a disease, or if you think that you have something, always it is better to clarify your doubts, rather than worrying about it yourself, or running to a hospital, or running from pillar to post instead. So we only promote online consultation through this. Thank you.
థ్యాంక్ యూ సో మచ్ డాక్టర్, చాలా బాగా ఎక్స్ప్లెయిన్ చేశారు. థ్యాంక్ యూ సో మచ్.
Thank you.